So what are the key signs that your patient or anyone you are aware of has migrated into this more toxic aspect? Well, the stress is compounded. There's more than one trigger. They can't seem to recover. Life feels out of control. They've lost the ability to have joy in their lives. Not that they're continually 24/7 happy, but they just can't seem to access that. And anxious is the new normal. They're waking up at 2 in the morning, 1 in the morning, 3 in the morning. They're preoccupied with something that causes distress. What's the downstream negative consequences? Well, with continually physiologically triggering all this norepinephrine, there are certain things that shut down. The parasympathetic system becomes overridden with the sympathetic overdrive. So even when you think you're relaxing by watching TV, you may not be. You may just be numbing out. Your gastrointestinal system begins to shut down its ability to effectively absorb nutrients, and your probiotic flora, the beneficial bacteria in the gut, which help us assimilate the nutrients that we eat from great food, become disrupted and need replenishment. That's why you see all of these suggestions in some of the research articles and also commercially of adding probiotics or live culture yogurt to food. The hormonal system gets very disrupted. I'm going to go into this a little bit further in a couple more slides. And the immune system initially is heightened in the acute stress response. In the chronic stress response is diminished. There have been studies as far back as 20 and 30 years ago looking at medical students who were taking tests in their first and second year of medical school and being given their immunizations like a flu shot, measuring immune response. And because of chronic stress, their effective response to that vaccination was reduced by as much as 50%. But you don't have to do this as an experiment to figure out if someone's having depression of their immune system. Just talk to these people who happen to be stressed, have excessive chronic pain that they can't deal with, and ask them, in the winter season, are you getting more viral illnesses? I wonder what their answer will be. So I alluded to the fact that there are hormonal changes with the stress response. And we now know that there's a very large upregulation of inflammatory cytokines. Insulin is released to, accelerate effective absorption of glucose, which is also released and also getting metabolized into the cells. And unfortunately, IGF-1, which is also an inflammatory trigger, is released. And what you'll see is many people sort of developing the metabolic physiology of someone who has metabolic syndrome or almost like type 2 diabetes. So glucose intolerance, if it's latent, will become flagrant over time. People will develop central obesity, and that in itself, that visceral presentation of fat will in itself become a factory for inflammatory markers. Okay, well that's sort of the mid-microscopic picture. I want to now even turn into what happens in the genes. Based on the work of Elizabeth Blackburn, Carol Grader, and Jack Sozak, who received the Nobel Prize in 2009 for their work in telomeres and telomerase. We don't usually look at genetic responses in the clinical arena, but some of their work that they've discovered is really eye-opening. Telomeres are the ends of chromosomes in cells. It's kind of like the end plates on the epaulets of shoestrings, and they keep the genetic strands from becoming frayed and lost. Telomerase is the enzyme that repairs these little end caps, because every time a cell divides, these telomeres become shorter. And what we have when we're in a robust, well state is sort of a balance. There's plenty of telomerase to keep lengthening these telomeres, and as the cells are dividing, because they need to, we always are replenishing cells everywhere, the telomeres will keep shortening. Over the last couple of decades, what we've been able to see from these scientists' work is that in chronic disease, there is an acceleration of telomere shortening. In other words, the telomerase, the repairing enzyme, cannot keep up. So in essence, you have an accelerated biological aging phenomenon. And this is across the board with many kinds of diseases, vascular dementia, diabetes, heart disease, pulmonary fibrosis, even cancer. And it looks like there are many things that are affecting this process. There are environmental triggers which might accelerate this aging. There are other genetic factors which may be synergizing and accelerating aging. There may be behavioral issues, and even stress. One of Dr. Blackburn's colleagues, Elisa Appel at UCSF, took a cohort of people who were chronically stressed. These were caregivers of an individual who had a chronic problem. They were inventoried and found to be excessively stressed. They had their telomeres and telomerase measured. And she was able to correlate that those with a higher amount of stress had shorter telomeres and far less telomerase. Well, what happened next was, I think, even more interesting. There was a follow-up study of a very similar cohort of chronically stressed individuals, taught a 20-minute stress reduction exercise done daily for 3 months. And what they were able to demonstrate was a lengthening of the telomeres and an elevation of the telomerase. In essence, this is probably one of the first studies ever to show that a psychological state could reverse, in the follow-up study, physiological aging. Now, other things have been done. A cohort, very small amount of people, women, 36 to be exact, were queried for their state of outlook on life, which was pessimism, and then had their telomeres looked at. And lo and behold, their outlook on life was correlated with telomere shortening. In other words, the more pessimistic they were, the shorter their telomeres. Very eye-opening. In cancer, we have another instance in which there's an excessively high amount of telomerase, which enables, you know how we have all of these cells multiplying and unchecked? One of the triggers that seems to be enabling this process is this excessive release of telomerase, plus cytokine enhancement. Here's a very recent release in JAMA looking at telomere length in severe aplastic anemia. And what was fascinating about this was there was no relationship between the hematologic response and telomere length. However, telomere length was inversely correlated with the probability of hematologic relapse. In other words, there was a negative correlation with overall survival, clonal evolution. So I think ultimately looking at telomeres and telomerase on a clinical level will be available to us and will be really fantastic because we'll be able to see at a much more definitive level how we're really doing in body response. Now here's a very, very hopeful study. This was a surprise to the investigators. They looked at a discrete piece or a set of individuals in the MacArthur aging study, measuring telomere length and telomerase at baseline and 2.5 years, and then looked at the likelihood of death over a 12-year interval following that. And what they found was that as the telomeres shortened, those in the cohort that had shorter telomeres were more likely to have earlier mortality. But what was more fascinating was that 24% had telomere lengthening or staying the same. And they said, wow, that's amazing. What did these individuals do? Lo and behold, what they found out was that they were living better, more effectively. They had changed their lifestyle, and it seemed to be helping.